Dr. Idell, thank you so much for joining us here on Health Connection. Our pleasure to have you. Our topic is preteen depression. Is it real? And you're a psychiatrist by practice. You treat patients of all ages for depression. We don't normally think of children, young children having depression. We don't think about that a lot. How real is depression in this age group?
Well, it's a real phenomenon. In the epidemiologic studies, it looks like as high as 2% of kids younger than 10 may actually suffer from clinical depression. And going back 30 years or so, this was thought to be a phenomenon or a disorder that really didn't happen to kids. But as time went on, what's been seen in both the literature and clinical practice is that in surveys, adults with depression have actually reported that they had symptoms going back into early childhood. And then in studies, we've seen that the development of brains of kids that are depressed seems to be different from kids that do not have depression. So there's been a convergence of findings in the literature that show that this is a real phenomenon. Up to 2% of kids have it, and that skyrockets up to 4 to 8% in the teenage years.
Some of the issues that kids, preteens experience seem to have, they might be dismissed by adults as seemingly insignificant. But what's the reality from the young person's perspective?
Well, I think it's important to keep in mind the developmental stage of a child, really. Their world is much different from that of an adult. They don't have bills, they don't have a mortgage, but they do have stress. And kids have a varying resilience to stress. There's a genetic component to that. And so something that may seem minuscule or trivial to an adult, like not getting picked for kickball, getting an F on a school report, something like that, could really be catastrophic to a kid. And it's important to really try to sit down and have a talk with a child as opposed to dismissing something that really, in their world, could be a really important event.
So let's segue into the next question. How can you identify when a preteen is suffering from depression?
So it can be more challenging for sure, particularly for the families and a kid that's maybe 10 years or younger. And it may look a little bit different than an adolescent or an adult who's depressed, but some warning signs can be extreme irritability or irritability in any sense, acting out more, behavior changes, school refusal, clingy behavior, really just a change. Sad kids really, it's not just a sadness, it's a sadness that stays. It's a mood that will not go away for weeks at a time. It doesn't really matter what's going on around the child. The mood stays down, and it's sort of this gloom, this dark cloud that stays there. And they may not be able to verbalize what's going on, but parents and families and clinicians that are looking at behavior can have some clues that I spoke about in terms of seeing what depression is there.
This is a two-part question. Are there varying degrees of depression, and explain to us the impact that depression has on preteen kids?
So yeah, there can be a range of depression. In the clinic, we label as mild, moderate, severe. For practical purposes, there can be changes in functioning, trouble in school, trouble with interpersonal relationships, making friends, socializing with other kids. Kids may stop eating as much, they may have trouble sleeping. And at the severe end of the spectrum with severe depression, you see, unfortunately, suicidal ideation, suicidal thoughts. Sometimes kids will write notes or in diaries or journals expressing that they're profoundly sad, and at times engaging in self-injurious behavior, hurting themselves through different ways, or sometimes telling their friends that they're having these thoughts. So there is a broad range of depressive symptoms, and it can be quite severe and debilitating.
Well, Doctor, picking up on what you just said, I know of personally, and I think people would know of kids who cut themselves, pull their own hair out. Mm-hmm. Are those kinds of behaviors driven by depression?
They certainly can be. It's not always driven by depression. It can be an indicator of depression, though. Some kids self-injure as a way of relieving tension or emotional distress, not with the express intent of killing themselves. So it could be indicative of other sorts of psychological issues or clinical depression. And it's something that certainly warrants clinical attention.
We hear a lot about bullying. It's in the news a lot. Is bullying a major cause of preteen depression, and how do you know if your kid's a victim?
So, looking at the model of depression that we have now, it's a combination of genetics and environment. You're born with this certain temperament, this resiliency to stress or lack of resiliency, and then stress happens, and that can take many forms. It can be bullying. It could be, some of the things we mentioned at school, having struggles academically or with friends or with peers or even at home. Bullying can be a severe stressor for kids that can lead to depression. It can lead to anxiety. It can lead to a whole host of consequences. Kids living in fear, having nightmares, things of that nature. So bullying can be a major stressor for a child.
How do you know if your kid are there ways you can tell if your kid could be a victim of bullying?
Ideally, you hope that your child will tell you, but if that's not the case, there are some warning signs that you could look for, such as bruising that's unexplained or injuries that are unexplained. They may come home hungry, unfortunately, because they've had their lunch taken from them. Things may come up missing, like textbooks or things like that. And maybe just appearing more anxious when that's not how they normally are out of nowhere, having sleep disturbance, like I mentioned. Just maybe appearing more fearful or clingy in some ways.
You touched on this earlier, but let's give it a little bit more color.
Sure.
What are some of the most common signs and symptoms of depressions in preteen kids?
Well, I think it's important to have a working definition of depression, and depression is characterized by depressed mood or sadness, a lack of interest that lasts 2 weeks, associated with at least 4 other symptoms. So the defining features of depression are difficulty sleeping, lack of energy, lack of appetite, pervasive sadness, decreased interest or irritability, and social withdrawal can be a major symptom as well. And unfortunately, preoccupation with death and suicidal ideation. Again, based on the age range of a kid, that can manifest a little bit differently. Younger kids tend to have more what we call somatic complaints, headaches, tummy aches, maybe having more difficulty with separation anxiety. And then teens tend to be have more negative thinking, like worthlessness, thinking that they're no good, or have low self-esteem, body image issues, things of that nature. So it can take a little bit different form depending on the age group. But the thing that cuts across all of the age groups, adults, geriatric, children, is this pervasive sadness that doesn't go away. It's that vitality is lost that really defines a person. And a child, we think of normally as being playful and vibrant and curious about the world. With depression, that's gone. The mood is just down, it's sad, and there are physical symptoms that we mentioned associated with it. Thinking changes. It really essentially hijacks every part of the body, every way of thinking, and can be really devastating to a child's development.
Once you've arrived at a diagnosis as a clinician, how do you treat depression in someone so young?
Well, I think getting a clear diagnosis is critical in guiding treatment. So there are a lot of things that have to be ruled out, like general medical conditions, substance abuse, or these things have to be taken into account, bipolar disorder. And then, also treating any sort of what we call comorbidities, that's other diagnoses like ADHD, anxiety disorders, learning disorders. A child has to be treated comprehensively, and it comes down to a thorough analysis of the stressors that a child's going through in order to come up with an individualized treatment plan that involves the family, the community, and in moderate to severe cases, psychotherapy is involved and potentially medication management. Psychotherapy being either cognitive behavioral therapy, interpersonal therapy that can be done through a trained psychotherapist, and then oftentimes for severe cases supplemented with medications. And the combination treatment for severe depression seems to provide the quickest and best treatment and really shorten depressive episodes.
Do children with untreated depression grow up to be depressed adults? And are there consequences to letting depression go untreated for many years?
Absolutely. It can be a chronic condition. It's not for everybody. But the best chance at having, leading to remission is early recognition and prompt treatment. In the studies, the Untreated depression can last months, if not years, and just an episode of depression. It tends to be a recurrent condition, as I mentioned, that comes back. But with treatment, those months can be shortened to weeks, or maybe a couple months or even less, potentially, depending on the treatment that's done. So with early recognition and prompt treatment, the likelihood of it becoming a chronic condition is less, but there is a certain population of people, up to 20%, that are considered refractory to traditional treatments. And then it becomes more complex. So it can be thought of as a chronic condition that really requires follow-up. It requires supervision and monitoring by the family, follow-up with the clinician to make sure that there's not a bad outcome.
You mentioned the family. What can parents and family members and friends do to help support a young boy or girl, a young man or woman who's fighting depression?
I think, really listening empathically and trying to really hear out a child, and encouraging an environment where a child can feel like they're being heard. Oftentimes I think, not intentionally, but families or community members may invalidate a child's anxiety or depression, or just not want to accept that someone's struggling. And that's not to blame the family at all. It's a natural thing. I think it's very hard to see a young person who's in distress like this. So what a family can do is really provide the emotional support through talking, through mentorship, through directing the child to someone, maybe a spiritual leader or someone in the community who they feel can be helpful. And then it's sort of back to basics with wellness. The things that we've been preaching forever really have been shown in the literature scientifically to affect mood, exercise, nutrition, really having a balanced lifestyle. And even things that are considered new agey, like meditation, have a growing evidence base to show that they can help with anxiety and, by extension, depression as well. So we try to teach families to take a multifaceted approach. And whenever there's doubt, there are resources on the internet that you can go to, like the NIMH has a lot of resources for families to look at, the National Institute of Mental Health. And untreated, it can cause a lot of problems in the brain, and put kids at risk for other mental illnesses as well going forward. As the science develops, we're seeing more and more what those changes in the brain are. But just suffice it to say that stress causes changes developmentally in the neurons in the brain we're finding more and more out about that by the day.
At what point should a parent seek treatment for a preteen who is exhibiting signs of depression?
My feeling is that if you see these signs of depression that we've talked about, that you see a change in your child, that you should seek out an evaluation and play it safe. Anywhere from 40 to 70%, depending on the study you look at, of teens are not being treated who have depression. That's found out by surveys in schools. So we have this huge portion of kids that aren't being seen for a number of reasons, whether it's stigma, lack of recognition, or shame about what they're going through. I think it's important to play it safe. If you suspect that you see a change in your child and you're not sure exactly what's going on, they don't seem themselves, they seem sad or irritable, notice some trouble sleeping or changes in energy levels, socially withdrawn, any of those can be warning signs that an evaluation is warranted, I think. And err on the side of caution, I think.
The symptoms you just mentioned, those all happen to us on a spot basis. You have a bad day. But how long does it continue before you start becoming alarmed?
So the textbook definition is 2 weeks. Again, anytime you start hearing a child with a preoccupation with death or thoughts of killing themselves that they've been really saying to anyone, it warrants attention. But the textbook definition is 2 weeks. It can last months at a time. And I think that's what really differentiates depression from reactive sadness or just the normal human experience. Normally we have a mood that is responsive to the environment. It goes up when something good happens. We're down when something unfortunate happens, and that's just not the case with depression. Kids with depression, and adults for that matter, stay down, and it doesn't really matter what's going on around them. They could be getting straight A's and captain of the football team, but still feel just this profound sadness that lasts for weeks, if not months. And I think that's really the key distinguishing feature.
Very well. Doctor, very informative, and we thank you for your time.
It's been a pleasure.